Welcome to today's training, Patient Engagement and Research, a Medical Assistant Training. We have a lot to cover today. By the end of this session, you will understand patient engagement in research and clinical care. You will understand patient-centered outcomes research and be able to describe why it is important to patients in clinical care. You'll understand the value of this research and be motivated to support it. You will know your role and why you are important to this research process. You will also know your patients' roles and why their inclusion is valuable. By the end of this session, I hope you will be motivated to engage patients in research to help improve health outcomes. My name is Peggy. I will be your guide through this training. I work for ReachNet, a PCORNet clinical data research network. My role is to help clinic staff, just like you, integrate research into their workflow. Today's theme can be summarized in this quote attributed to Dr. Donabedian, a physician and founder of the study of quality in healthcare and medical outcomes research. Patient involvement is the ultimate validator of the quality of care. Let's start with you, the medical assistant. Here are some facts about your profession. 591,300 medical assistants were employed in 2014. 82,201 medical assistants are certified by the American Association of Medical Assistants. There are more than 62,800 medical assistants registered with the American Medical Technologist. Medical assistants are employed across the United States. In fact, your profession is growing much faster on average than any other job. Medical assistant jobs are predicted to increase 23% from 2014 to 2024. I've mentioned these facts to highlight you have the potential to impact healthcare. Most medical assistants work in physicians' practices. Did you know that you spend, on average, 50% more time with your patients than the providers? Because you spend more time with your patients, you can get to know them better, and they may share important pieces of health information with you. This partnership you build with your patients is very important to helping them feel included, accepted, and heard. A key part of being an MA is building this partnership of trust. This is just one of the reasons that your role on the patient's care team is very important. The patient voice and this partnership is valued more than ever before and is key to the changes happening in medical care. Medical care is changing. During the last 10 years, there has been a change in healthcare from an authoritative, doctor knows best approach to a collaborative approach with patients. You may have heard of patient-partnered care, shared decision-making, patient-centered care. At the heart of these ideas is patient engagement in their own healthcare and the healthcare system. According to the Center for Advancing Health, engagement is defined as the actions we must take over time to obtain the greatest benefit from the healthcare services available to us. This requires patients partnering with an entire care team that supports patients making the changes that are most important to them. As you may know, patients may not consistently do the things they should to benefit from healthcare that is available to them. When your patients are unable or unwilling to actively participate, engage in their care, they are more likely to get preventable illnesses, pay more for their care, get sicker, and see their quality of life decrease. Have you seen this in your patients? You can support, partner with your patients, engage, to help them do the things they should. Research has shown that the more actively patients are involved in their health care, the healthier they become, and the less money is spent on health care. The lessons learned from the benefits of engaging patients in their healthcare is changing how research is done. In the past, research occurred outside of the patient's regular place of care. Researchers informed clinicians of study results. Clinicians could then make changes to care based on study result recommendations. The ability to transfer this knowledge of research findings into practice has been limited. Study findings are filtered through different professional organizations who make changes and recommendations. These recommendations may or may not be read or adopted by clinicians. Communication has been one way. We have learned we need to engage patients in research to better understand what is important to them. For better quality research, to empower patients, to be transparent and fair, and to increase the translation, distribution, and use of research results. Please watch this video to see how powerful the patient voice can be and how patients are changing the direction of health research.
For most of history, patients have been the passive recipients of medical care, with little or no role in medical research. Early in the last century, patients began to mobilize to accelerate progress for their conditions. In 1938, when President Franklin Roosevelt founded the March of Dimes, it marked the beginning of a new approach to philanthropy, one directed by patients towards finding treatments and cures for their diseases. Since then, roles for patients have expanded dramatically, but until recently, the pace of progress was slow. It was not until 1973, when the Patient Bill of Rights was adopted by the American Hospital Association, that patients could reasonably expect to be told their diagnosis and have a voice in determining their care. Then, in the 1980s, the HIV/AIDS movement catapulted patient needs to the forefront, dramatically altering the public policy landscape and creating a model that other disease advocates would later follow. By getting smart on the science, not just loud on the issues, AIDS activists demanded change and got results. Throughout the 2000s, the role of patients as partners began to permeate the R&D landscape, spurred by technology that connected and empowered patient communities. Forward-thinking venture philanthropies like the Michael J. Fox Foundation for Parkinson's Research and the Cystic Fibrosis Foundation stepped up to fund and support the kind of research that moves basic science down the path toward treatments, helping to bridge the so-called Valley of Death. In the years since, many of these organizations have gone on to co-develop therapies with industry, providing both funding and research-ready patient communities. In 2003, the Milken Institute established a Center for Accelerating Medical Solutions called Faster Cures to speed and improve medical progress across diseases and put patients at the center of the system. Soon after, Faster Cures convened the Research Acceleration and Innovation Network, TRAIN, a group of disruptive, patient-led foundations focused on finding and funding novel science. Around the same time, networks like Patients Like Me began showing up on the internet, gathering data about the real-world nature of disease directly from those living with it. In 2010, the federal government initiated a series of efforts to more formally incorporate patient input into decision-making, from PCORI to PFDD. And in just the past year, a perfect storm of policy and engagement opportunities has formed. Kicked off by the 21st Century Cures Initiative in the United States House of Representatives, these efforts are elevating medical research on the national agenda and expanding the role of patients. What began as an extension of patient advocacy has grown into an emerging scientific discipline, the science of patient input. At Faster Cures, we have always been laser-focused on integrating patient needs and perspectives into the full spectrum of decision-making, from the time a new therapy is discovered in the lab until it is delivered to the market. Whether we're expanding opportunities for patients to influence policymaking, building bridges between patients and other R&D stakeholders, or fostering more entrepreneurial, patient-driven philanthropy, we put patients at the center of everything we do. cutting through the roadblocks that slow medical progress and advancing the outcomes that matter to them most. No longer just passengers, patients are now co-pilots, helping to navigate the future of medical progress. We all know someone who could use a faster cure.
Patient engagement in research is now a topic of national importance. The Patient Protection and Affordable Care Act required the Department of Health and Human Services to support patient engagement. This has brought patient engagement to the doorstep of your clinic. In March 2010, Congress authorized the Patient-Centered Outcomes Research Institute, PCORI, to be formed to focus on patient-engaged research. PCORI is a nonprofit, non-governmental agency funded by the Patient Protection and Affordable Care Act. PCORI is a thought leader and top funder of this new type of research. PCORI defines engagement in research as the meaningful involvement of patients, caregivers, clinicians, and other healthcare stakeholders throughout the research process. PCORI proposes that including patients and other stakeholders in the research process will lead to trustworthy and usable information likely to be taken up in practice. Patient-centered outcomes research brings together people who need to be heard, especially people who have not been involved in the past. Patients, caregivers, researchers, clinicians, advisory groups, and stakeholders work together for better informed research. PCORI proposes that including patients and other stakeholders in the research process will lead to trustworthy and usable information likely to be taken up in practice. Patients and other stakeholders are involved throughout the research process more consistently and intensively than before. A lot of planning goes into a research project. When planning a research study, the topic and research question is selected. A review of similar research is conducted, and a decision is made on the method or way to conduct and analyze the study. When conducting the study, data must be collected, and then results are reviewed and interpreted. In the dissemination stage at the end of the study, results are translated into written form and published. When engaging patients in research, the process expands. Even before a study begins, there is a need for patients to be involved as partners. Patients work with research teams to develop the research question to make sure it captures what is most important to patients. Patients also help decide which group should be included in the study and can co-design how the study will be conducted. As the study is being conducted, patients continue to have an active role. Patients help the research team understand the patient perspective. They edit study materials to be user-friendly and easy to understand. Patients also suggest the best way to recruit participants into the study and are involved in interpreting the results from their community's perspective. Patients play a key role in making sure study results are quickly shared with groups beyond professional researchers. This can include doctors, clinic staff, community leaders, and the patient community. Patients identify the best ways to reach each of these groups and ensure the messages are meaningful and well received. Are you wondering where you fit into this process? You know your patients. You have worked to develop a relationship with them. You are in a unique position to make improvements to the health of your patients. You can help to affect change in your patients by supporting positive, healthy behaviors, including participation in patient-engaged research. You can use your influence and expertise to encourage your patients to speak up about their health experiences so that research addresses what's most important to them. Help their voice be heard. As patient-engaged research expands, you may see changes at your clinic or physician office. Your patients may be asked to participate in research studies that are taking place in your clinic. Your clinic will likely be involved in more research projects. Your patients may tell you about focus groups or health advisory boards they have joined. Patients will have more opportunities to contribute to research studies that are important to them. We ask for your support of these changes. Beyond what's happening in your clinic, there are a number of ways for you and your patients to become involved in patient-centered outcomes research. PCORI is a leader in patient-engaged research and a good resource if you or your patients want to learn more or get involved. You can actively seek opportunities by suggesting a patient-centered research question, providing input during formal public comment periods, joining an advisory panel, or actively participating in patient-centered projects. Learn more at pcori.org/getinvolved. Another way to learn more is to explore PCORNet's patient-powered research networks and encourage your patients to join one. These are condition-specific, patient-centered organizations. Here is just a sample of the health conditions represented. Learn more at pcornet.org/patient-powered research networks. Your health system may already be involved. One PCORI project, the Patient-Centered Outcomes Research Network, PCORNet, is connecting health system data across the country with a mission to support patient-centered outcomes research. See if your health system is affiliated with one of these clinical data research networks. Learn more at pcornet.org/clinical data research networks. Hopefully you now have a better understanding of patient engagement in research and clinical care, and have gained some knowledge about patient-centered outcomes research. We hope you have learned this research is important to patient care, and you now understand your patients' roles and why their inclusion in research is valuable. We hope you recognize the key role you play in this research process and will support patient-centered outcomes research. Thank you for your interest in learning more about patient engagement in research. This presentation was brought to you by the Research Action for Health Network, one of the many projects of the Louisiana Public Health Institute.